Hi everyone, welcome to the webinar. We will just be starting in another 10 minutes. We are waiting for Dr. Ashalatha to join, and I hope you will learn a lot in this webinar today. Hi, Dr. Ashalatha, how are you?
I
Uh,
see.
Hello?
Then
Hello? Hi, Dr. Ashalatha, can you hear me? Am I audible?
yeah, I can hear you to some extent.
Okay. Hi, how are you?
I'm good, thank you.
Welcome to the webinar.
Huh?
Welcome to the webinar. Let us know whenever you're ready to get started.
Yeah, thank you, thank you.
Okay, so shall we start?
Yes.
Okay, so hi everyone. First of all, thank you so much for joining us today
Wait for
on
10
this.
minutes. Let's wait for 10 minutes. Attendees are joining.
Okay.
Until then, Dr. Ashalatha, would you like to share your journey with us? And meanwhile, attendees will join in. Let's give 5 more minutes for them to join and then we begin.
Why the voices I can hear it very soft. I'm not it's not very loud. No, my you're able to hear me clearly?
Yeah, I'm able to hear you. Is your volume turned on?
Volume
Okay.
is full, maximum.
Okay. Maybe it's the speaker, I'm not sure. Can you tell me about your journey, doctor? How did you, get into this field, and what excited you to be a fertility doctor? I'm very curious to know.
Yeah, uh, definitely. See, after MBBS, the gynecology was the last thing in my head to do.
Oh,
Yeah, then I joined my master's program in School of Medical Science, where reproductive medicine was one of the option. So I happened to choose that because I didn't like any other options I had. And there, it was like meeting Dr. Baidyanath Chakravarti, who was the first person to do IVF in India. Though it is not
oh,
officially announced, Durga was born in Kolkata, first IVF baby. So,
okay,
so we had IIT Kharagpur School of Medical Science had this reproductive medicine attached to this Institute of Reproductive Medicine in Kolkata, run by Dr. Chakravarti. So that's how my reproductive medicine or infertility field journey started. So
okay.
and I heard how the first IVF baby, how difficulty they had, from where, like the Edward Steptoe from Bonhall Clinic, how they were doing it, how in India they were struggling to do it, and how finally they could do it. So all this was interesting me, and then finally I did my PhD also in fertility with him in Kolkata itself. So around 7 years I was there with Dr. Chakravarti. So we were doing a lot of research with him, you know, and we have published a lot of articles in international papers and all
Sounds very
that. And
interesting. What was your first choice when it was not fertility or IVF?
sorry,
What was your first choice when you were, pursuing your MBBS? What did you feel like you
uh,
wanted to, which field?
it was dermatology,
Oh,
dermatology and cosmetology, like, no night duties, no emergencies. That was
yeah.
my first choice. Yeah, but then now when I see the joy in the couple's face when they conceive and they hold the baby and come to my clinic, really, I said I did the right thing. Now I really feel proud now.
That's so nice. That's very, very interesting. I have never heard a doctor say that, we started out just to, start our journey in dermatology, and then somehow we found our way towards gynae and, fertility, and then contributed our life towards it. So it's very interesting.
Yeah. So,
And
uh,
how long have you been in this clinic?
how long has been?
How long has it been since you've been in the clinic?
So it's been actually from almost 15 years now.
Yeah,
Yeah,
that's quite a
15
long
years
time.
I have started on my own. So before
Hmm.
that, we were working as a team with other, institute. But my own institute, it's been 15 years now.
Okay, great. Okay, I think we have enough attendees to start, so I will just start with the introduction. Um, all right. Hi, everyone. Thank you so much for joining us today for this very special session by IVF Plus. Pulse. We are here to talk about something that most couples don't get guidance on, which is how to choose the right IVF clinic and, how to avoid the common mistakes that most couples make. And we could not ask for a better expert than Dr. Ashalatha, senior fertility consultant and founder of Wellspring Fertility, with over 15 years of experience, like she said, and 1,000 plus IVF success stories. Doctor, over to you.
Yeah, thank you. I'm really very happy to share this, whatever you've been asking. And see, after failure, to think what went wrong later, it's better to have a good start. So I think that is where we should choose the right clinic, and you know, than rather think, oh, I should have done that, or what went wrong, why did not happen, or why it failed, rather.
Mm,
It's this conversation is about helping the couples, start the right thing, choose
mm,
the right clinic.
yeah, that is correct. And what is the biggest mistake that you see couples that they make when choosing an IVF clinic?
Yeah, see, these days people they go for the glamour, they go for these ads, they go for big big names, and then how modern it looks, etc., etc. But behind all this, there is something like the lab, the protocol, the whole team. IVF works like a team. And all this actually decides the success rate when it comes to IVF. In our clinic, we have seen so many patients come to us after 3 2 failed IVF cycles. And when we go through their reports, we don't see sometimes so many reports are missing, and the protocols what has been done has not have not been individualized. And also this IVF is all about timing. Okay, so some clinics, when it comes the egg retrieval especially, or IUI, when it falls on a weekend, they try to postpone it. Even that is also one important factor. Okay, all this we have to individualize, and we have to customize basically, and then do the treatment. Then it can work really better. We can get better success rate with all this.
Okay. And what about, something called live birth rate? Is that a better way to judge a clinic success?
Definitely, see, all clinics they talk about success rate, and they say that it's a pregnancy rate. They mean pregnancy rate by that. Okay, couple will conceive with the treatment. They say that you're pregnant, couple is pregnant, but the thing is, between pregnancy till the delivery, there are a lot of things also that can happen. So
Hmm.
again, that all depends on the lab factor, etc., etc., patient profile factor, everything. So it's always the live birth rate or the take home baby rate, we call it. That is what matters. And it is not like on the whole we can say, okay, this clinic has this kind of success rate. Success rate also differs with the patient profile. Say if the patient is above 35 years or having low AMH, so the success rate varies with these things. So we always share with them what they can expect with respect to their case. This thing patient needs to be informed, they need to know about this.
Makes sense. Makes a lot of sense. So about this partnership and, the quality of a lab, why is that such a big deal? Is it, about an embryologist? What is it exactly about?
Yeah, like I said, it's all about timing. One is egg retrieval. When do you have to give the trigger? That is 36 hours before we decide to give the trigger. We try to, timing exactly. And once this is done, when we retrieve the egg, also when do we insert the sperm, like the fertilization time. And once you do the fertilization, your denudation time, all this, etc., etc., everything matters. An in-house embryologist who is well trained, who's well qualified, you know who will keep having the details of the embryo, who will check at the right time, who will change the dish at the right time. All this matters. So at each and every step, we try to keep our patients informed, like what is the status of their embryos today. Because we culture it for nearly 5 days, and the patient will be really keen to know what's happening,
Mm, that is
right?
true. That is
So
absolutely.
in-house embryologists throughout, is a required.
Hmm. Okay, so to Bimal's question, we will take questions at the end of the webinar, Bimal. So we will set aside like 10-15 minutes for doctor to answer all of your questions. So the next question that I have is, can you give an example of how an IVF treatment should be personalized?
Yeah. See, individualized as in the cause of infertility is so many, like PCOS or poor ovarian reserve, endometriosis, or it's just mere tubal block or the stress factor, etc., etc. So each of these conditions needs a different kind of approach. What many clinics try to do this is, one size for all. It doesn't work like that. So at our clinic, we customize whether it is stimulation, whether it is follicular scans, whether it is culture method, whether it is protocols, which cycle, we are going to do, etc., etc. Freezing, whether we are doing freezing or we are going to do a fresh transfer. Everything based on the need of the patient. What we should do, we do that.
Hmm. So in your clinic, like you said about the whole process. In your clinic, how much do you think this process is, 100% there, and why people should be considering that, okay, this fertility clinic is the best. This fertility clinic makes the most sense for us. Is it because of the, quality that you guys have with the embryologist, with the kind of the equipments, the process, the knowledge that you guys have?
Yeah, yeah. Definitely, I'm going to tell you that why our clinic, because at our clinic we use this IVF Pulse platform for this unique tracking ID for the patients, where they can get this real time update of all their reports, whether be it their blood reports, whether be it their follicular scans, okay, whether egg retrieval, what kind of eggs, how many eggs, and what is happening to their embryos, what is happening today, day one, day two, day three, how many embryos we have, how many has been frozen, etc., etc. All this kind of gives, peace to that patient, confidence to that patient, and they don't have to wait and keep calling the hospital. They are not picking, and they call somebody in the reception. They ask them, what is happening. They say something. These patients understand something, and get stressed out. All this, will finally come to success rate only. The more stressed they are, less is the success.
Hmm.
So all this, I think, definitely makes us unique.
Absolutely. I think it's very important for people to understand how, there has to be no middleman in between. It has to be you, the doctor, and the patient, so that there is absolute transparency. There is absolute ease in their heads to kind of understand that, okay, whatever is going on, we know about it. Like we talked about this tracking ID, right? So is it like that whenever they open that tracking link, they would be know that this stage has been completed and now it is in this stage, and now the next
Yes,
stage will be done in the next day.
yes, yes.
I think that's a great way to be transparent. That is the first time I've actually heard about something like this. All
Yeah.
I've
See,
always heard
before
about.
they ask, they have the information before they even ask or start thinking or start assuming or, start panicking what could have happened. So that kind of, calms them down, at least to certain extent.
So how many cycles does this take? Like, let's suppose a couple comes to you with a request for IVF, and they want to conceive. But how many trials does it really take to actually conceive?
It depends. It depends on a lot of factors. Okay. If a patient is having bilateral tubal block, means both the tubes are blocked, then we straight go for IVF. But before going for IVF, we try to give them some supplements, for one cycle or two cycles. And then we try to improve the quality of egg and sperm and then go for IVF. So once we decide, okay, they are undergoing IVF in this cycle. So one cycle for egg retrieval and the next cycle we will do the embryo transfer usually. So I think 2 to 3 months minimum is required. But having said that, they may not conceive in the first attempt itself, you know. So with embryos, they may conceive in the second cycle also. Frozen embryos will be there. We can do the transfer in the next cycle. So it depends actually. But yeah, if they conceive in the first attempt itself, maybe 3 months.
Hmm. And can you explain what IVF in its truest form really means? Because I think there are a lot of misconceptions out there about IVF. Like you just said, it'll take at least 2 to 3 months minimum, right, for a couple to conceive, and it'll not just be in the first go. So I think there's a lot of misconception around it that, once you go to the doctor, just the next month you will be uh, getting the good news. So, what does IVF in its truest form really mean? Like, what is the definition of it?
See, IVF means in vitro fertilization. That is, fertilization is nothing but a single sperm entering the egg and becoming an embryo. So in vitro is it's happening outside the body. For this, we need to remove the eggs outside, take the sperms outside, and uh, put the sperm inside the egg, and then culture it outside. That is in vitro fertilization. So lot of injections are given to the wife, from average maybe 10 to 12 days of injections, and then once the egg matures, we take the eggs out under anesthesia. So this process itself is like almost 15 days. Okay. So this retrieval of the eggs may be around 10 to 15 minutes, but because anesthesia is given, recovery from anesthesia will take 2 to 3 hours. So they can go on the same day they get discharged. And then after this, we culture them, fertilize them before that, culture them for 5 days. So another 5 days, we have after 5 days, if the uterus is not ready to accept the embryo, which usually it is because we have removed so many eggs and the hormonal milieu has changed actually. So we freeze them and then we have to wait for the next cycle for everything to settle. Okay.
Okay.
So next cycle, when everything settles, again we prepare the uterus now. So to receive the embryo. And that again takes 15 days. This is all like, physiology. We have to go with the physiology. We cannot go against the nature. So we give the supplements to prepare the uterus, and when it's ready, which takes around 15 days, then we put the embryo back. After that, we need to wait for 15 days. We have to give that much time to know whether she's conceived or not. So like this,
Okay.
it takes like, this is when everything is okay and happens as we
Okay.
plan. But something could go wrong. We may not get the exact lining what we want. So many things can happen. The partner may need a hysteroscopy. Something is not good inside the uterus. So we are not getting the good lining what we are expecting, like this.
Okay. And how do you, like, let's say you have to get inside and check the uterus. Do you do that after the first cycle of, putting the embryo inside, or before that only?
Yeah. See, whenever we decide we have good number of embryos with us, which is frozen, the next step is transferring the embryos. So while we are transferring the embryos, before that we have couple of things. So when everything is okay, think it is okay to transfer, then only we transfer. So while seeing that the lining is not coming maybe as expected, the blood flow to the lining, and also the hormonal status, the progesterone levels, all this we have to see. And also we do a mock transfer, that is a trial transfer without the embryo, which today I did. So it's a Sunday, but because it's a third day or fourth day bleeding has stopped, I had to do it on that day only, because there is no use doing it later or before. So when
Okay.
we are able to easily negotiate the uterus without any trauma, then we know, okay, we can do the transfer now, plus all the other parameters. If we are not able to negotiate the uterus properly during the mock or the trial transfer, then we arrange for a hysteroscopy. That is again done under anesthesia. We check, we put a camera inside the uterus and see. There could be some anatomical problem, congenital problem, birth defects, some fibroid which is sitting there and not allowing the conception to occur. So, like this, there are so many things which we make sure everything is okay and then only go for the transfer.
Okay. That sounds very interesting. And what about this? So as you said that, the whatever eggs are there, you freeze them for later cycles. I have seen this trend nowadays that women tend to get their eggs frozen around, let's say, in their late 20s to make sure that they're able to conceive later. What is your take on that? Freezing eggs. Is it
Yeah,
safe? Is it, how does it work?
yeah, it's definitely good if for a career oriented person who wants to delay their marriage and all that, because in a woman, number of eggs are fixed before she is born. Okay, there are
Okay.
no new eggs which is formed after birth. Okay, it only decreases the number. Okay,
Oh,
every cycle she loses certain number of eggs, and this is like one way traffic, it is not reversible. So
oh,
in that context, when you see uh, till the age of 35, all the good quality eggs are released. Okay, and after 35, the number and the quality of the egg starts reducing. And in fact, nowadays we are seeing premature, poor ovarian reserve or failure of ovaries. So we see less number of eggs less than 35 years of age itself. So when you know that you're going to delay your marriage and all that, and egg quality is very important for the success rate, you know, it's better to freeze your eggs and keep. So this is
oh,
actually a very good option now. IVF, we can do that.
okay. So when we talk about freezing the eggs, you do that under again general anesthesia, and
Yes,
you
yes,
take
yes.
the. Okay.
Everything is same. We give injection for 10 days, 15 days, whatever it is. And then after when the eggs mature, we give anesthesia and we retrieve the eggs. Like how we do for the other couple, same way it is done. Only thing is
Mm.
we don't fertilize them, we just freeze the egg as it is. And they can use it whenever they want.
Okay, and
Because
then it is stored in a bank.
yeah,
Okay. That's great. I think that's very important nowadays with with the lifestyle changes that women
yes,
are going
yes.
through, and how early on I think they start feeling that the cycle is getting disturbed, and the flows is getting disturbed for the menstrual cycle. I think that's really important nowadays.
Yes, people are not aware, but then who we are having couple of egg freezing every month. So one person only is freezing like for 2 3 cycles, so that they are at peace and they think they can like do whatever how they have planned. Accordingly, they can postpone and get married whenever they want.
One more misconception that I've heard a lot around this topic is that, let's say a woman got her eggs freezed at 30, and she's worried that at the age of 40 will the eggs still be of the same quality, or like some people think that it'll get bad because it's frozen for such a long time.
No, that's a wrong. This one, that's a myth actually. Whatever stage or type you store, it remains like that. Nothing changes inside the cryo can. Okay. If like for maybe some patient may have not that great egg quality while we have retrieved at the age of 20 itself, because we have seen menopause even at 26, 27, though it is rare, but then we see those kind of patients, especially post COVID. Okay, at 30s they don't have much eggs. Okay, so if it is already bad, so when we take out also it remains same. But if it's a good quality egg, when we take out it is same. Nothing changes inside. What we retrieve, same thing will be there. Whether it is 1 day, whether it is 1 year, or whether it is 10 years down the lane. Whatever we freeze, same thing we take it out.
Oh, that's the first time I've heard of a woman having menopause at 26, 27, 30.
Yeah, there are some conditions, chromosomal conditions, anomalies where they can have a early menopause. Though rare, initially it used to be rare, but now because of the lifestyle and all that, maybe at 35 something we see what we should have seen at 45. You know, egg reserve getting lower and lower.
Hmm. And when we talk about freezing eggs and going through the whole IVF journey as a whole, there's needles, there's a lot of anxiousness and everything. So what about the emotional side of IVF? I think a lot of people are unaware of the emotional side.
Yeah. See, if it is just egg freezing, not that much going through injections every day, for 10 days or 11 days, whatever it is, and then subjected to anesthesia. That an apprehension will be there with the patients. But here, we don't talk of failure or success. But yes, when it comes to IVF for the couple, it's a roller coaster ride of emotions, definitely. You know, so and not enough clinics will concentrate on that, counseling part. We do have one to one counseling, try to reduce their stress. That's what, by keeping them well updated and informed, everything we can, do lot of ease for the couple.
Hmm.
And we can have clear conversation with them what to expect in their case. And it's a long journey. Like I said, for some couple it may just get over in 3 months and they conceive, they are happy. But they should, we make sure that they don't feel confused or rushed.
Hmm. Absolutely. I think that's very, very important for a couple to go through that conversation, to have that one-on-one talk with someone professional who can understand their emotions, console them, make them realize that this is all normal and this is a journey that they have to go through in order to achieve the result that they desire. I
Yeah,
think that's very important.
yeah, very important for the success rate.
Yeah. Yeah. I mean, if the woman is stressed and she's not able to function properly and her hormones are going everywhere, then it's really difficult, I think, to
And
uh,
mostly what happens is these days people tend to Google and see, like, oh, okay, this many eggs are coming, this is the size, what will happen. There is lot of information, on the internet loaded, and they get more stressed with that. It doesn't help them in any way. They take stress and give us also a little bit stress from that.
Yeah, I think it's a lot of it's a one size fit all on Google, and a lot of people fail to realize that they have different complications, different bodies with different hormones and different birth genes, I guess.
Yes. Yes, they don't understand that, but then they try to get information as much as possible. But that only is harming them, what I could
Yeah,
see.
that is true. I think doing your research is another thing, but completely relying on Google and then questioning whether this is right or wrong is another thing.
Yeah, that's what I advise. Whatever you have, write down. You come, however stupid it is, however small it is, you ask me, I will explain. Don't Google it, because you will never be get the right information.
Exactly. And this is such a, crucial part of their life that I think they cannot rely on Google at all, because it's just such an important part. You're, injecting yourself, you are trying to make a baby, and you're trying to, do all of these procedures to get to a point where you can conceive. So I think having as many stupid questions as possible would be the best way to go.
Yeah.
Hmm.
Yeah, we should give them that confidence, that counseling. Yes, you can ask anything. You can ask. You talk to me. I'm there
Yeah.
here to help you. That so
Yeah.
that
I
confidence
think
is that what we give in our clinic. That time also.
Yeah, I think making that safe space as a clinic is very important for them.
True, true, true.
And when we talk about these clinics and safe spaces, what are, a few red flags that patients should not oversee? They should never ignore that.
Yeah, first of all, this thing they say that 100% success, which is really scary because nowhere we can get 100% success. Also, few clinics I've seen, they are like very recently opened and they claim that so many babies born. I don't know how. Okay, it's very difficult. And also the summary, what has been given, what has been handed over to the patient doesn't have any details what has been done. So many times when they come to us with 2 3 failed cycles, like, see, we may also have failures, but we know what we have done. And when they go to somebody, they'll know, okay, this has been done already, so next, for the next time we can try a different protocol, all these things. So there are some places where I see nothing is there clear. What has been done, how many eggs has been retrieved, what was the quality, what was transferred. You know, of course, we can't explain why, exact reason why it failed, but then at least we should have all the details, right? Even those things are missing in so many clinics. And like I see the protocols also, like I mentioned before,
Hmm.
there are multiple protocols, so it is not mentioned clearly.
And the right support, the right mentorship, the
Who the embryologist is, what is the details, like all these things, if it is there, so we also then understand, or wherever they go, people know what has been done, what we can do next, so that we don't fail again.
hmm, makes sense. I think these are very important things to keep in mind while choosing a clinic, because I think there should be, whenever people are doing their research, they need to have like a few options, and they need to probably visit first, check out the pamphlet that they have, what are they offering, and look out for these red flags, and then decide for themselves if they want to continue with that clinic or go to some other doctor.
Definitely, they have to choose a partner, not just a clinic,
Yeah.
because it's a journey. For long they have to our cycle is only for 30 days, we can't hurry it, right? So it's
Yeah.
a journey. So, like, yeah, here our goal is, I can say, to make the patient feel safe, well informed. And then, go with them involved also.
But that's well said, that it should be, they should look for a partner and not just a clinic. That's something that should stick by. I think that's very important. Okay. I think we can take questions now. Uh, Everybody, if any questions you have, you can just type it in the message box, and doctor will answer to your queries. Till then, I think we have a few questions. How do you select a good IVF center? Okay, that's second. Okay, yeah. One very important question that I see a lot of people asking is, what is the cost of IVF? Nizamuddin has also asked this question. What is the cost of IVF?
The cost again varies with the protocol we use. On an average, I can say that for a cycle, it may cost, including freezing. Again, there are a lot of things, frozen embryo transfer. So, all this, if you consider somewhere between 3 to 5 lakhs.
3 to 5 lakhs. I think is that per cycle, per like one.
See, per
Uh,
cycle, as in, the, like I said, if you're not talking about freezing and all, so it will be like less than 3 lakhs. And if you're frozen, if you're using them for the frozen embryo transfer cycle, then you will have to, again spend around 25-30 lakhs per cycle. So, like that, which cycle you're going to have it, we don't know. For how long your embryos are going to be frozen, we don't know as of like now. And also post transfer the medicines, this. So approximately I can say between 3 to 5 lakhs. Of course, there are people who finish their whole cycle like by 3 lakhs itself, within
hmm.
3 lakhs.
Okay. And
And if
we
hysteroscopy is there, it keeps on adding also.
okay,
So
as
that's
many
why,
things that you will encounter.
yeah. So it can go up till 5 lakhs. That's what I'm saying.
Hmm. Okay, makes sense. And we spoke about women and their egg freezing and their, egg quality decreasing by a certain age. But what about men? Nizamuddin has also asked this question that is the sperm quality going to decrease after 40, after the age of 40?
Yeah, we do analysis. Age really doesn't matter that much up till age of 60, 55. Everything we have seen good quality sperms somehow. Yeah, but post COVID, the scenario is changed actually. We are seeing more of poor quality sperms now. Okay, maybe I don't know, COVID infection or the vaccination or the lifestyle. I don't know what it is. But yeah, after doing the analysis, we can treat some, if some parameters are not okay, we can treat them, and then definitely we can freeze sperms also. It's a
Hmm.
lot easier to freeze sperms and less
Oh,
expensive also.
how's that?
See, for egg retrieval, you have to go through all this, right? Giving injections and all that. But freezing semen is not at all this is not required. They just walk in, give the semen, we freeze it immediately. And the
Hmm.
cost
Much
also, there's
simpler.
a lot of, yeah.
Nice. Okay. And Santosh has asked, how do I need to know whether normal conception is possible or I need to go for IUI or IF? What are the parameters we need to consider?
Yes, like I said, if for a woman both the tubes are blocked, then there is no way that she can conceive naturally. IVF is the only option. If the tubes are open and all other parameters like the hormones and the uterus in the scan and the sperm quality is good and her age is less than 35, definitely natural conception can be tried.
Hmm.
So after that, another thing called IUI that also can be tried for 2-3 cycles. When that doesn't work, then the last is IVF.
IVF. Hmm. Nizamuddin has asked another question about unexplained fertility and how do you treat it?
Yeah, again, unexplained fertility, we don't know the
Sorry,
cause. Like whatever we
unexplained,
have done the test, uh,
unexplained.
everything appears to be normal in the test. Both the tubes are open. So that is when we don't know the cause, we name it unexplained. So in unexplained, if the age of the patient is fine, then we can go through step by step, trying naturally for 3 cycles. It doesn't. Each one of them have a different success rate. When we time the intercourse and tell them, okay, this is when you try naturally, up to 10% success rate we have when they try for 3 cycles. And the next is IUI up to 20% success rate, we can see.
Hmm.
So in unexplained, it's better to go step by step when we know everything is okay. So we can always try 2-3 cycles of first two options and then go for IVF.
And we spoke about the red flags, right? What are some red flags that we need to look out for in a clinic? But what are some right set of questions that someone can ask when they're going to a IVF clinic or a hospital?
So they can always ask the doctor like what is actually wrong, what is expected with respect to their reports. You know, what can we expect? How long it may take, right? You
Hmm.
know, so in these kind of cases, what in your experience, what is the success rate you have seen? All this they can ask, you know,
Hmm.
what
And
is the other alternate if this doesn't work?
then, makes sense.
Is the last, yeah, option.
Okay. And sperm pH, does it matter? Is Nizamuddin asks this.
Yes, definitely to certain extent it matters.
What is the range between which it should be?
pH should be more than 7.5. If it is less, it suggests that there is some infection. There could be a lot of pus cells and antibiotics may be required. Usually whenever there is an infection, the pH reduces. It is supposed to be alkaline.
Okay. And is there any bed rest required after, after I think one cycle of IVF is completed?
No, after the embryo transfer, most patients think bed rest is required. It is not at all required. It is like any other pregnancy. And if it's a healthy pregnancy, there should not be any bed rest required. Of course, we tell them not to do some physical activity which will give pressure on the lower abdomen. Okay, some exercise like jumping and some asanas and all that to be avoided, whichever will put pressure on the abdomen. Otherwise, normal walking, routine activity like cooking, going to office can be done. Only first 2 days we ask them not to go to work and all that because that's the time for implantation to occur. Other than this, even then we have like foreign patients when they come after the embryo transfer, next day only they travel, they conceive.
Oh, that's nice. So we can just
Yeah.
go about their normal life without um putting some time aside for
Yeah, but
resting.
then sometimes if the patient wants to hear bed rest, we try to tell them, okay, you take bed rest because some people wants to avoid working because of
Yeah,
in-laws or whatever, blah blah blah. Then because finally we have to see they are at peace because that is what matters for
yeah, that is
conception.
true.
Yeah, but there are certain conditions, ongoing pregnancy that will require bed rest. But that is not, it's because IVF. That could be
Hmm.
because of the placenta, because of so many other reasons. Any pregnancy, bed rest would be required, but that is definitely not, it is because of IVF.
Hmm. Okay. And Pradeep has asked, is IUI a must before going for IVF? And generally, how many IUI would be tried?
Generally, I try up to 3 cycles of IVF. Well, people also try out up to 6 cycles. The patient is young and if they are okay emotionally, because what happens when we try too many cycles, they lose the confidence or hope even for IVF also. That should not happen.
Hmm.
So theoretically up to 6 cycles we can try.
Okay. And Santosh has asked, conception happened naturally after 5 weeks, miscarriage happened. Does it indicate any problem about tube blockage? Do I need to go for IUI or IVF?
Natural conception has happened 5 weeks miscarriage. Usually tubes are normal. Okay. But 5 weeks, maybe because of the quality of the egg, sperm, or something wrong with the uterus, there could be other things.
Hmm. So there needs to be a
Definitely not.
proper analysis.
Yeah. Usually, first 3 months miscarriages will be problem with the embryo itself, like the egg or the sperm quality. Usually, the nature tries to throw out the abnormal ones. That's how it is.
Oh,
Usually, but not always.
hmm. Makes sense. And we have the last question, I think, of Nizamuddin only. Endometric lining size, which is good for conceiving.
So they want to know the thickness. What is the thickness required?
Yeah, I think so.
Somewhere between 8 to 13 is the ideal thickness.
8
8
to 13.
millimeter to 13 millimeter. Less than this or more than this is not good for implantation or conception. It's
Oh.
not just the thickness, it's the pattern, it's the blood flow. So many things matter.
Hmm. So it's not just a one factor, it's a whole again analysis of it's an
Yeah.
individual body thing. Hmm.
Yeah, whether it is like whoever it is, of course, 8 to between 8 to 13 millimeter is ideal. That is when we do the transfer. But along with this, there are other factors also we consider equally important.
Okay. And Pradeep has asked, are there chances of having twins, go more in IVF?
Yes, definitely. In IVF, twins are common. They would have seen with their friends or relatives. Why? Because we try to transfer two embryos.
Hmm.
That is why chances of twins are higher. So, what we think is like it's better to give twins than to give a negative result.
Yeah.
Is where. But if the couple wants or they are very sure of they don't want twins, we can transfer single embryo because abroad and all they do single embryo transfer only. They don't do
Hmm.
two embryos. So that
Okay.
can be avoided. But still, single embryo also have a chance of twin pregnancy, like how it occurs in a natural pregnancy. Though that is very rare, not as common as IVF pregnancy.
Okay. Okay. And can you share, the place, the location of the clinic, a little, some details about it?
Yeah, it's on the Richmond town, Mother Teresa Road.
Okay. I think we have answered all the questions in the chat box. If there is any other question, please feel free to write it. Till then, I just have one last question from Dr. Ashalatha. For anyone who's watching, who's considering IVF, what would you want them to remember the most out of this session?
Sorry, can you come again?
Yeah, for anyone who's considering IVF and who's watching this webinar, what would you want them to remember the most?
See, if they are just starting to explore or anything, please ask questions, compare, contrast, take your time, and then you decide.
And like Dr. Ashalatha said, it's about choosing a partner and not just choosing a clinic.
Yes, definitely. Look for
And
this.
yeah, and
Yeah.
everyone who is asking for a little more details about the clinic and everything, you can stay connected with us through the community group of IVF Pulse, and you can get a free consultation. You can talk about getting a free consultation in the group itself. And I think we are done with the questions as far as I can see. And it was a great session, I must say. I have myself learned so many things about IVF and, a lot about the misconceptions that I had about whatever I've heard were cleared absolutely. So thank you so much for that. And thank you so much for your
It's a
time.
pleasure. Thank
I
you.
hope you will be joining us very soon with another webinar.
Sure,
And
sure.
for everyone who's watching, if you want to explore your IVF journey with guidance, please feel free to message us. Please feel free to come and join the community group. And we are giving first free consultation for our webinar participants. And yeah, thank you so much for this beautiful session.
Thank you.
All right. See you. Bye bye.
Bye.